Today we're going to talk about recommendation in casting technique of the Townsend Design Premier Ankle Brace. These recommendations and protocol will help ensure an appropriate fitting ankle brace. Townsend Design requires or requests fiberglass casts. Since Townsend Design makes the ankle brace out of pre-impregnated carbon fiber, we have to fill the cast with a 16-pound foam. When using a plaster cast, our parting agent won't allow us to remove the cast at all. So we need fiberglass because that's the only system by which our parting agent will allow us to remove the cast negative. If we get a plaster cast, what we have to do is fill the plaster cast, wrap it with fiberglass, and then refill it with foam. So not only do we lose detail, we lose time. We applied 1/4-inch sticky back felt to appropriate and important bony prominences. The primary purpose of the ankle brace is to control or correct specific ankle and foot instabilities and/or deformities. We do this because some of the bony prominences are not prominent, and indelible marks often migrate during casting. Since the Premier Ankle Brace specifically addresses frontal plane instabilities with a very small surface area, it makes it especially important that these bony prominences are accurately identified. We place the felt on the navicular, the prominence on the calcaneus, and the base of the 5th metatarsal. Here we're determining the ankle axis ML. We're determining the height of the brace, which is the base of the calf. There are 2 reasons why the Premier Ankle Brace calf band height can be lower than a typical AFO. Since sagittal plane control is not needed in the Premier Ankle Brace, except for in the Dorsey Assist model and/or the plantar stop model, lever arm is not important, so we don't need to go to 30 millimeters below fib head. We do not need the length. Secondly, there are 2 heights that you can do an AFO or ankle brace. Either you go to the base of the calf or you go 30 millimeters below fib head. If you go between the base of the calf and the fib head, you tend to get impingement on the calf muscle. So the ankle brace, we choose the lower height, which is sufficient except for in the cases of a Dorsey Assist or a plantar stop design. We're measuring ankle axis height. Here we're applying the cast sock and the cutting strip tube. This is going to be a posterior calf band brace, so we're putting the cutting strip on the anterior. If this was an anterior tib brace, we would make sure that the cutting strip is off the tibia crest. Here we're applying indelible marks on important areas such as ankle axis, navicular, head of the 1st metatarsal, base of the 5th metatarsal, head of the 5th metatarsal, toe sulcus on the medial and lateral side. Here we're applying the fiberglass casting tape from distal to proximal. We're making sure that we're not stretching the tape, that we're rolling it on the patient to prevent roping. We're positioning the foot in as neutral position as possible. Achieving this neutral and/or correct position is important. It's much easier to make the brace from a corrected model than to modify it to the correct position. Here we're marking the cut strip to ensure proper cutoff while maintaining proper alignment. Here we're using our cast saw to remove the cast. Here we're using a cast spreader to assist. Here we're checking alignment to ensure that the cast was done appropriately. The X's are the areas where we place the 1/4-inch sticky back felt. While your casting technique may differ from this, we have found this technique or protocol has resulted in many positive patient outcomes.